Dr. Ramprasad Gopalan here, owner of First Class Medicine, Infectious Disease and Travel Medicine Specialist, affiliated with 8 local hospitals here in Palm Beach County. Again, that's infectious disease, actively treating patients with COVID-19. You won't dare see me on camera because I'm not dressed, and if they slip up and get me on camera, the whole house is grounded. But you'll be hearing my voice and I'll be reading your questions that are popping up. So just to remind you, we're on L Khanna Productions. So if you have questions, you're gonna have to go to the original source, which is L Khanna Productions Facebook page, to get your questions in. Aw, and Jennifer Goldman says she loves us all, and we love her too. Okay, so Ram, you ready? Do you want to introduce yourself? Are you good? Are we good?
Yeah, we're good. Hey, as you all, I'm Dr. Gopalan Ramprasad, owner of First Class Medicine. And let's talk about what's going on in the world about COVID-19, and hopefully I can answer some of your questions.
Okay. So, first question, we'll just jump in with that. If I go in a building with an elevator, how should I proceed?
Okay. As you guys, who are not supposed to be touching any surfaces with your bare hand, you could use your elbow, because the part that is coming in contact are your fingers in your hand. So you minimize your risk of contact with your mucosal surfaces by using your elbows. But if you do use your hand, I think it is a good idea now to use all those hand sanitizers you guys bought, and I personally, do carry, one in my pocket, because I probably will wash like 1,000,000 times a day, and more than that, I do carry one of these for times where I'm in between, 2 stations where I can wash. So wash your hand, minute you touch it, make sure you have it ready in your left hand.
Thanks.
And that's it.
Can I make my own hand sanitizer out of whiskey?
Julie, I think the only hand sanitizer you'll be making is via oral route. Well, there are many options online, but I think it's better to get the commercial one until we get to that phase of life where we need to make one.
Ram, why is it called COVID-19? Some people are saying that it stands for Chinese origin virus. Just for the record, I saw that shared by healthcare professionals.
I'm sorry to say, in spite of what you hear on TV and the mainstream, CO means corona, VI means virus, D is disease, COVID-19. Technically, it was supposed to be SARS-CoV-2, and that's the virus. And COVID is coronavirus disease of 2019.
Okay, so I won't name my recipes accordingly to this acronym. Fine, keep going. How long from exposure till you pop positive on a test? Pop positive on a test? Like if I was exposed tomorrow at work, would I test positive days later, or how many days?
Usually, the test what we use is called RT-PCR. In simple terms, it tests the genetic material of the virus. So if the genetic material is in your nasal passage, even a minute amount, we do amplify. So hence the test is very sensitive. But if you're exposed now with 1 or 2 viral particles, you probably would, it would need amplification. And probably in the days you would be positive. The people, who are being tested, I think, we'll answer that later on. But in days you will be positive. That's the population, who need to be quarantined.
Okay. What are the most common misconceptions you're seeing regarding coronavirus?
Well, the common misconception is that young people do not get this disease, and you can still be partying and not have any consequence. And common misconception, you just walk in and you get a test. Common misconception.
So how does that really go down? Let's say I want a test.
No, you don't get a test. You don't need to get a test.
You have to meet some sort of criteria.
Because here is the problem, number one. That would have been an ideal scenario where we should have been prepared for that. You needed a test, so be it. We should have had a test. contrary to every single thing you hear on TV, we are running out of materials to do the testing, like swabs and reagents. Now, the test turnaround time is pretty long until now, but we are getting into the area where the test turnaround time will be shorter. So, at that point, who should be getting tested at this point? If you're having a mild cough, fever, stay home. By you knowing, at least you should be quarantined. Just presume you have it.
That's good.
Presume that you have it. Quarantine. Practice good hand hygiene, good environmental hygiene. However, if and when tests becomes available freely with supplies and plenty, at that point, yes. Right now, it should be reserved for people. If I come in contact and I really need to get tested because I am seeing patients who are with and without the disease. So, although we're using,
So this brings me to the next question, then it's a legitimate question, okay? If I test positive and my best friend tests positive, can we go hang out and quarantine together? No, that's a legit question that came in.
well, although if yes, if you both are positive and you're two are support structure, and you are young, relatively healthy, and you better be true positive when it's not a false positive, then the chances of you getting the disease definitely exist. Even say you are positive, following strict precautions of hand washing, keeping your surface clean, still should be able to.
Yes, because we definitely had quite a few questions coming in with people that are frustrated that they want to get tested and they can't get tested. They're not meeting criteria. One question that was pretty unique, there's one here. If you know two people in the office that have traveled in the last 3 weeks and were just sent home today, does that constitute a reasonable request to get tested?
No, absolutely not.
Okay. I know you have to be experiencing symptoms, but we're not. Besides washing hands, wiping areas, is there anything else we could be doing? So then another person had written in that she wanted to get tested at her doctor's office. I just need to find it real quick. She wanted to be tested at her doctor's office, and she didn't meet the criteria, but her question is, really, I don't have all these questions in front of me. Number one, our Florida numbers are highly undercounted because they are not testing. Only 800 tests administered in Palm Beach County according to the news today. Two, I have a house full of people that I prefer not to catch it if I do in fact have it. These are her basis for wanting to get a test.
Wait, can you repeat the last part of the question?
She has a house full of people that she'd prefer not to catch it if she does have it. So like you're saying is presume you have it and start quarantine.
Okay, what is she a healthcare worker? Where do you
No, she's not. She just she said, I would like to be tested. I spent 2.5 hours on hold with the care on demand doctor, who said I needed to go through to qualify. I don't have trouble breathing or a cough, but had a low-grade fever, body aches, chills, weak, dry mouth since 3/16. I lost my taste and smell, which is one of the newest symptoms on the checklist. The virtual doctor said she would recommend testing, but there are no sites in Palm Beach County. I told her I was willing to drive to the closest one, that is in Coral Springs. She said she had to call me back. Okay, so that led her into her reasoning why she feels strongly about being tested. One, our Florida numbers basically saying are grossly inaccurate because we don't have enough tests, which is correct. Two, she has a house full of people, she'd rather not catch it if she is infected. And three, if I am infected, I would very much like to donate my plasma to extract the antibodies once I am able to help others. So with all of that, I want to be tested.
I understand. You have very valid points, but the problem at this current time is since the testing materials are in short supply, now we are reserving most of the tests for patients who do meet the checklist of criteria. Yes, you have parents, grandparents, or household of people who are possibly, by a word eye, just presuming have underlying issues. But okay, now take this scenario. You are positive and you did a test, you are positive, and you're not sick enough to be in the hospital. You're back home. What would you do? So just presume there and do exactly what you would do if you had tested positive. There comes a time, I am hopeful that anybody and everybody who requiring a test can get a test done. But at this point, we need to conserve resources, and this would be one of that where you need to give up some for the greater good, and that is what it is.
Okay, question for Ron tomorrow. What are the chances this thing is mutating? It seems to be more and more younger people affected by it.
Well, influenza virus mutates, so does this one. As of the new studies, so far, it has remained relatively stable, genetically stable. Hence, the hope and chance for a good vaccine is higher and higher. Younger people did get in the population of the world, so there is nothing new here. So older people had issues with bad outcome, but that is across the board. This is not new to US.
So I'm gonna ask the next question, and it was from a direct Facebook PM. They said, are children dying from the virus? The CDC is saying different symptoms. So it's a two-part question. Are children dying from the virus? And then the CDC is saying different symptoms. What are the symptoms we should be looking out for in this very moment?
Well, here the children have very, very low risk of morbidity, mortality. A different immune system, their immune responses, whereas adults may have a haywire in their immune response to this virus, children may not have that exact response. The youngest, one, as you see in the news, 18-year-old may or may not have had multiple other comorbidities. Generally, this is a disease which affects everyone, but in the younger population, the outcome is better because of less comorbidities. Symptoms have remained same. The children not coming up with any different symptoms than the adults.
Yeah. Okay. Lily, ask the one from the teacher.
So I had a teacher ask me a question today. She reposted my story, and one of her students asked her, does smoking marijuana put you at an increased risk for contracting COVID-19?
And can you write me a prescription? Yeah, they want to know if you're going to write me a prescription.
Okay, here is the thing. Smoking in general, smoke inhalation will send your cilia, which is supposed to have protective mechanism against viral illnesses, because they have something called peristalsis. Basically, they'll sleep the virus out. So if you burn the mechanism where your body is trying to expel these things out, whether you smoke marijuana or you smoke, your tobacco, anything, but it still has a deleterious effect on you. Hence, I would refrain from doing that.
Jeff Lindsay asked a question, and that is, what is your best estimate of when Florida and the U.S. will peak with the coronavirus cases? News media says we're 2 weeks away from where Italy is in this very moment, and in this afternoon we were second to China in coronavirus cases.
Actually, we surpassed most of the numbers, but the number where we are in peaking, we will peak as the epicenter of US coronavirus cases from New York. People should not have moved from there and propagated over here or to any other places knowing they were sick. And unfortunately, the last positive cases, most of them have connections to City of New York. And anyway, but what may or may not. So please follow the quarantine, even if you did come from New York City or anywhere where the case density is higher. Quarantine yourself, proper health hygiene. Do not go outside or to crowded market, restaurants, and just do follow.
So then that leads me to a question someone had about having their cleaning people come to the house. Is it safe to have your cleaning people now with all the snowbirds returning?
Well,
Or
keeping your area clean is important, but it again goes back to the question: who's infected, who's not infected? Stay in place, or quarantine in place when it's in effect. You would not be certain that somebody who's going to 50 different homes are not at risk. So hence, now you got all the time in the world, start cleaning.
Do you want to take the next one?
Yeah, so that leads me to the next question. After I leave the hospital, I wash my work clothes in hot water. Is that sufficient to kill COVID? Do I need to buy laundry sanitizer also?
No, I mean regular laundry. What I do personally, as soon as I come in, it is stripped right in the laundry room, goes in the washer. So now for the first time, I bought scrub bottoms too. So yes, regular laundry detergent is perfectly fine.
Can COVID live suspended in the air for hours? There has been some discrepancy over this.
There are a lot of discrepancy in there. So presume it to be in the air for up to 2 to 3 hours. Hence the N95 mask recommendation. So we are presuming as if it is suspended in the air for now.
On a very similar note, there's a question. It can't be transferred by water, right? So are community pools okay?
Although the water in itself is not a medium. Now just think about going to a community pool. The surfaces you're going to touch, people who are around there, that in itself will pose a higher risk than the water in itself. So hence, avoid any community areas where multiple people are in contact. So I would avoid it for the reason of surface contamination and contamination by different people, not by water itself.
On the same note as water, does sipping water wash the virus into your stomach?
There's no studies. Hot tea? No, there is no studies that has been done about it. Is what we call a lipophilic organism. It sticks to the fat cells or fat, and it enters through a receptor called ACE2. However, it's not a macromolecule where it just floats around in the mouth. So, I mean, no studies have been done, nor does it kind of sound logical at this point.
Okay. So with that being said, wine is still safe to drink, right?
So we have fun with that.
Okay. I have had a low fever, 96.5. I heard it can be a low or a high fever.
No, fever is not 96.5. Yes, initially you may or may not have a fever, but every one of them do exhibit fever in the course of the illness. So 100.2, yes, if you're normally very your temperature, because each person is unique in that scenario. So 96 and 97 is not a fever.
Does blowing a hairdryer in your face kill the virus?
Please don't burn yourself. None of that has shown to do. Washing your face with soap and water, yes. And there are studies where covering, for healthcare workers, covering the head.
Ooh, this one I've heard so many times. Okay. Do I need to wash my groceries to be safe? How careful should I be? Because a lot of people are using Shipt, right, and Instacart.
Okay.
What about the bags? Especially, let's say you're immunocompromised and that's why you're taking advantage of Shipt or Instacart.
Correct. There have been a lot of thoughts about this particular process. Using proper technique to wash and cook, which we should be doing all along, would kill the virus, and cooking most of the items where you're trying to use should be able to kill it. And there are methods where you can wash your vegetables. If you go online, you will find how to use water,
But when you
potassium
cook the
permanganate.
food, cooking it would kill it?
It will die, sir.
Okay, because my girlfriend had a good idea to get the food. She was gonna order food, but like finish the cooking process at home, almost like casseroles and things, but finish the cooking process at home to kill it. So that's a good idea then, right?
I mean, yeah, even the cooked microwaving, should be fine. I mean, the surface, you see, it's not just the food in itself, but if the person who's bringing it, the medium of transport, the cardboard box or the wrapper or what have you, so those, if somebody coughs or sneezes on it, you may have it. So hence,
Okay.
trying to avoid that contamination is more important than the actual food itself.
Is it possible to have only digestive symptoms and not anything else but be tested positive for COVID?
Yes, there are some people who symptoms are nausea without vomiting. They're coming with GI symptoms. Yes, they do have that kind of presentation. But majority of them whom we have seen here have upper respiratory symptoms so far, and some of them do have GI symptoms, as you're asking.
Sorry, go ahead.
Can septic work catch COVID-19 via fecal matter?
Well,
I wonder
You
who
have-
asked that.
we do.
Southern
we
Septic,
do.
everybody, for all your septic needs, family business.
Yes.
It is isolated in the feces, yes, but the prevalence of infection by that route is still not studied, but it is shown to be in the feces, yes.
Does losartan or other blood pressure meds give an extra layer of protection?
No, on the contrary to that, there is few school of thought. American School of Cardiology says you got to talk to your cardiologist before you stop ACE inhibitors or ARBs. That's where losartan is. The premise, what was thought, the why we should stop these medications, when you take a ACE inhibitor, what happens is the receptors, what the ACE is binding to, will have something called upregulation. In simple terms, the number of receptors the body need goes up. That is the receptor the COVID-19 attaches to and gets inside the cell. So the idea is, if you are blocking all the doors, then your entry is limited. But if you are opening million doors, if a person A has 100, person B has 1,000, so the probability of infection, severity of infection increases with ACE and ARB. But the jury is out on it, and
Well, can you also explain real quick the relationship between NSAIDs? So, is are NSAIDs only a problem if you're being treated for it, or if you are positive for COVID?
no, for everybody. Here is why. Because again, it has. There
So
are
just walk us
many
through
many
what
thoughts.
NSAIDs are also.
Huh?
Walk us through what are NSAIDs, some commercial
Okay, NSAIDs means non-steroidal anti-inflammatory drugs like your ibuprofens,
Motrin,
or Motrin, that is
Aleve,
Aleve,
Advil.
and that category of medication which you normally use to take, for pain. Okay, two things. One, in certain viral illness, there is a syndrome, what is called Ray syndrome. If you use aspirin, which will have deleterious effect usually in the children. So that is number one. And there have been some school of thought where it upregulates the ACE2 receptors, so hence may have a deleterious effect. So let me tell you, none of this have concrete basis, but these are all anecdotal and multiple studies have been going on. It's, this disease has been in this world for only a few months, and we have a lot of studies going on to finally delineate and tease out all these.
Can symptoms show after 14 days?
Yes, they can, because although it is up to 14 days, so people have shown up to 27, 29 days, in the literature what we have reviewed, but generally it's within 14 days. Majority of them do show if they have to show symptoms.
So will you just walk me through, like, one more time? Let's say I have a fever, I'm young, I'm healthy, relatively young. All my kids will be grounded if they say otherwise. I'm young, all of a sudden I don't feel well. I have some mild shortness of breath, but nothing crazy. I'm getting a fever. Let's say I climb up to like 102, 103, a little scary. Should I be rushing to the hospital as long as I can handle myself at home, or what can I be doing?
Okay, the key point what you did say was shortness of breath. If you have to watch for the shortness of breath. Having a fever, taking Tylenol, having symptomatic care, fluid, staying. Tylenol you can take. Tylenol is not an NSAID. Tylenol is.
Oh, never mind. Sorry, I just blanked out. Yeah.
Yes, you can take Tylenol. So, but if you have a fever and if you do take Tylenol, having ice packs, having comfort care, and you're able to eat, able to tolerate food, you're okay to stay home. Shortness of breath is another. If you're walking from chair to the table and you're short of breath, you need to go to the hospital. But if you're just having, you feel like you're short-winded, you're doing all your normal activity, although you don't feel good, just you're resting and you're okay, maybe it's a good idea to stay home.
So now let's say I'm still well, what if I'm on the fence? I'm not sure if I have it, no shortness of breath, I've got a fever, I feel crappy, and I show up to the hospital. Are they going to test me?
No, we are, again, in the matter of conserving resources. If you're not sick enough to be admitted to the hospital, they are not going to test it. At this point, you will not get tested, just because of the fact the turnaround time is still pretty prolonged. So you're not getting your test result very quickly. And although some facilities are getting within 48 hours for some, but still the average time is taking 6 to 7 days.
Wow.
And some even longer. So in that scenario, what is the point of testing if your symptoms are not severe? If you are getting admitted to the hospital, you should be tested, because if you are negative, we are conserving a lot of resources to come and see you, like personal protective equipment, which is really in short supply. So you're negative, then we can conserve resource.
Okay, so I'm going for it because this is a real question, okay?
Oh boy.
God gave you white blood cells. How come everyone's not using yours? It's a legitimate question.
I saw that.
Well, in majority of them, the white cells go down. In this scenario, that's one of the hallmark of the disease, not to go up.
I think it's important to also say we don't have
The ability to turn them on.
Oh, wait a minute. I was
They
trying
want to know
to.
why you're not using it.
Oh, why we are not using it? Okay, the body.
Why you made the choice not to use them today?
Yeah, why
Okay,
don't
the
you
God
use
did
muscle?
give us white cells to protect ourselves, but it's the body that decides what to do, when to do, how to do, and we have absolutely no control over the white cells, or its usage. But the other way to look at it is, yes, unfortunately, the most severe consequence, the body does mount a response which goes haywire, and that would be the cause of serious deleterious consequence.
So there was an article in the Washington Post recently that was saying, citing pink eye as a symptom. It said 1 in 30 cases in China. They want to know, have you seen it? And do you think it could be because coronavirus enters the body through the eyes?
We haven't seen, after seeing many cases in the county, that's not one of the symptoms which is presenting in in this area. Can coronavirus enter through the eye? Absolutely. Hence, we have full protection, including goggles, face shield, any mucous membrane need to be protected. Yeah, it can enter. Yes.
Okay, my girlfriend who's from out of state said they think I have it, and I got swabbed on Thursday last week, and the health department waited 6 days and it dried out. So I redid the swab again today, but now I'm wondering, would it still show up if I had it?
Well, 6 days, and if you have any symptoms, if you do have symptoms, you still have viral replication.
Okay.
There are cases where they have shown the virus to be present 2 weeks post resolution of symptoms. That means after you got better, it still has been shown, but the importance of that is unknown. But you probably will still be positive 6 days into the illness.
Okay.
It's me, Davey, reading the next question. How can I protect myself when I'm home all day, but my husband and son are still out working? Should we be separated?
Okay, it depends on what kind of work your husband and son are doing. It depends on what their contacts are. Also, it depends on how good their personal and hand hygiene, environmental hygiene is. If your husband and the son are healthcare workers, well, they are at risk, just like me. Hence, keep the distance, practice safe hand hygiene, and you already are isolating yourself from the community. Unfortunately, this is one of the scenarios you got to decide case by case based on the kind of work, kind of risk both your husband and son are at.
I'm gonna blend two people's questions. It's gonna be just a few parts. So first part is, how long after you're infected would a test come back negative?
Negative or positive?
Positive.
Negative. So when would somebody technically?
Like a retest then.
Yeah. When would this virus exit your body? You'd be considered healthy again.
Well, after the symptoms, there are many studies, they've done within 3-7 days, repeated twice, most of them. So right now in this country, we don't even have supplies to do the first test. Hence, we are not even venturing into that arena. But the tests what we've done outside this country, once they're asymptomatic, they have done in the intervals of weeks. And there are some who have shown positivity 2 weeks after. But you got to remember, this is the test which we use as viral particles. A dead virus particle will also show up. Although it may not amplify, or low viremia, it may not amplify a dead virus, particles may or may not amplify.
But how long would you be sick, feeling, the fever, how long would you be feeling that
This
for?
is as varied as the person. I have had patients who were sick for a few days and very mild symptoms. They're stable as rock now. And I've had, unfortunately, very deleterious consequences.
And then can they get infected again later in the future?
Headline news. Okay. Does our warmer weather help in the containment of the virus? Hence, would our rate of transmission be lower than New York?
I'm sorry, repeat the question.
What did you send?
No, I'm not going to read that.
Does our warmer weather help in the containment of the virus? Hence, our rate of transmission be lower than New York?
Okay, the question about warmer weather having less of a transmission. Remember, Singapore is a tropical country, so Australia is in their peak of summer. There are cases there. So although it may be possible to decrease, I'm not hoping too much of hope on just weather alone, because if you go by what has happened so far in China, Singapore, and Australia, So yes, you know, environment may help a little, but that's not all it.
Should we pump? Should we wear gloves to pump gas?
Okay, very excellent question. But here is the thing: you do see million people wearing gloves and running all over the place. Glove is a single-use, single-purpose, single-source, utility. What I mean by that, you're doing an act. You put on the gloves. After you finish, you please remove the gloves and you put it on in the trash can. Why? Because you touch the surface and you think nothing is getting into your hand by wearing a glove. Here's the problem. It stays on the plastic surface, inanimate object, pretty much as it sits on your hand. So a dirty glove can do this as much as a dirty hand. So proper thing, after you use your hand, wash with hand sanitizer. So that actually saves you better than using a glove and keeping the glove on for all day, thinking you're protected. Yes, in a gas pump, you can do two things. One, if you do have a glove, you put it on, you can use it and make sure you throw it out after you're done. Or put hand sanitizer before and after. And I've seen people use all the bleach, wipes and everything you guys bought by boatload there. That is a good place where you can wipe the handles before and after.
Thoughts on the hydroxychloroquine, Z-Pack, and antivirals for treatment?
Well, have I used these medications to treat patients, and currently am I treating? Yes, there are guidelines to use these medications, and your healthcare provider will decide at that time, is that right for you? It is not at this point given to patients who are asymptomatic, and two, they are not without side effects. Thing about these two medications, the first two, Plaquenil, that is hydroxychloroquine, and azithromycin, it has been in the market for a long time, has been used in plenty of patients, and we have had good data on the side effects of these medications. So hence we know what to expect, what not to expect from this medication. So yes, it is one of the therapies which at this point have been used.
This is a scenario that was sent in. They said that if you know 2 people in your office that have traveled in the last 3 weeks.
I think so, we did that.
Oh, you did?
Mm-hmm.
Yeah, we did the question.
Yeah.
Okay, then I have one more. What are the chances of this mutating? Because it seems that more and more young people
I think we
are
did the
having it.
question.
We did?
Yeah, we did that, and
Okay.
About it mutating?
Wait,
Yes.
Allison's
Yes.
got a question for you. She wants to know, how long is an infected person typically sick for?
I did
and
that one.
Can they get infected months later?
well, the first part of the question was answered. The second part of the question, do they get infected later? Well, so far the
So
antibodies.
she wants to know specifically, are people immune to it after, or can you catch it again months later?
This is correct. This is the question being investigated, since the disease has not been here for months or so far. So there have been antibody response. That means anytime you have a disease, the body does make protective antibody. So they are studying the response of repeat infection in this scenario. My hunch is you should be able to protect yourself with antibody response for a short period of time at least. As so far the virus does not seem to be mutating too much, or polymorphism as we call it, not many clades. So you should be able to do okay. But time will tell.
I have one more. I have one from Miss Glenda. She asked, you might have covered this and you did, so if you could just briefly go over this, because I've seen a few questions of this nature. But if you're buying vegetables and fruits and things that you're not cooking, are you allowed to do this? And then if you are, how should you properly clean them?
Well, there are, even before COVID-19, there is a proper method for all the fresh fruit and vegetables. There is a technique to wash them effectively There are multiple agents all the way from potassium permanganate to many other agents which are safely consumables, which you can wash your vegetables to get rid of pesticides and germs and most of the organisms on top of it. Yeah, so if you're immunocompromised and if anybody around you is, so you should avoid raw vegetables with uncooked vegetables.
Oh, that's right.
You should,
like
should not.
any precautions.
Yes, so you should not be doing that at this point. So, based on the source, I mean, cook and eat. And if you're not sure, just make sure you follow the proper. There are multiple ways you can wash your vegetables and be safe.
In your opinion, what is it going to take to get this under control and timeline?
In my opinion, a proper quarantine so the virus does not propagate. If you see the world around us, the people who did not follow proper isolation techniques or methods have suffered severe consequences. We are behind the 8 ball in testing. Yeah, people are saying, South Korea as a model who tested everybody and they isolated people who were positive, and hence the drop in the curve as it did. Unfortunately, we missed that ball. Now, please, my advice is, if you're from an area which is heavy infection rate, like New York, New Jersey, or any area where the infection rate is so high, avoid going to the areas with lower infections. Avoid travel, it's for the greater good. Stay put. When you're here, always listen to your healthcare advisories by your state, local health officials, and what is put out by your counties. And
sorry. Are there any cases where the mother has passed it on to her fetus?
none has been documented yet, and so far I'm sure the studies will be ongoing, but no what we call vertical transmission as I've heard yet.
The rest seems to be just a lot of thank yous for doing this and inquiries on when the next one will be. So we will keep you all updated, and thank you all for your questions. I hope this was helpful, and we'll give you any information about when the next one will be. So big thank you to Dr. Ramprasad Gopalan with First Class Medicine.
Thank you all. Bye.
And Davey Masala, L Khanna Productions, and Nikhil Ramprasad. So bye everybody.